I saw this comment and I thought it would be a good jumping off point to discuss what happens when you have mesh. Do you settle the same way as you do without mesh? What can you expect? So I know you had a lot of really specific questions and I can't give specific medical advice, but let's just talk in general about mesh in particular. So with breast reconstruction, which is what this commenter said she had, we traditionally would use a different type of scaffolding called dermal matrix. Now, dermal matrix has a lot of stretch to it. So when you would have a reconstruction with dermal matrix, everything would settle and stretch with time. And so we used to tell people like 20% stretch. With mesh, it's a totally different story. So with mesh, we really don't see settling the same way. You certainly always settle somewhat after any type of breast surgery, but with mesh, things stay kind of where you put them and there's not a lot of movement. And this is a big change for those surgeons like me who started using ADM and have now transitioned into mesh. So where we used to put things a little high and we expected everything to come down with time, now it's more important to put things exactly where we want them because they're not going to come down with time as they used to. Now, how long the process takes really depends on the type of mesh you use. So there are some meshes that dissolve very quickly and they don't leave behind firmer collagen. So those meshes I don't like as much. I don't think that they add as much support, and you will see more settling with time. So some meshes are gone in a couple weeks to a couple months, and then there's other meshes that can take a very long time to dissolve, a year to 2 years. And when they dissolve, they leave behind a little firmer collagen, which is what keeps the implant up and doesn't allow as much settling. So for you as an individual, it's always important to talk to your surgeon and find out what type of mesh they use, and they should be able to give you some direction about how long it takes for it to dissolve, and also if it completely dissolves, and should you expect some settling with time. So the tightness you feel right after surgery, that's the same no matter what type of mesh you use. It even happens without mesh. And that usually peaks at about 4 to 6 weeks, and then at 8 weeks you'll start feeling things soften as the collagen remodels. So right after surgery, things are tight. They usually tighten more for a few weeks and then they'll start to soften. And usually 6 months to a year is the time frame we give people to where things will soften and then they will end up where they're going to be at that point.